Hello, everybody. Welcome to the Healthy Enterprise Podcast. If you're a first-time listener, welcome. I hope you enjoy the show. And if you're back for more, thank you. I appreciate you returning as a listener as well. So today we're going to be talking with Kevin Harris. He's the president, CEO, and co-founder at CureMetrix. Kevin has led teams for 20 plus years in tech, and he's going to talk about how AI is changing the game in healthcare, especially in radiology and breast cancer detection. So let's have a chat with Kevin. So Kevin, welcome to this episode of the Healthy Enterprise Podcast. Thank you for joining me. I appreciate your time. And so why don't you introduce yourself to our listeners and tell us a little bit about what you're doing?
Well, Heath, thank you very much for hosting me. I really appreciate it. It's a pleasure to be here. My background is kind of interesting. I've been in technology in one flavor or another for about 30, I guess now 35 years, so a bit of a stretch. I actually have a degree in what's called cognitive science from the early 90s, late 80s. And
Okay.
so that was kind of that was AI before AI was really AI, right?
Yeah, no kidding.
Because way back then the compute power was not real strong. I mean, these were before Microsoft Windows even came out, right? So you
Right.
think you have to go in the Wayback Machine to really think about that.
Yeah, like a hot
And
tub time machine.
yeah, and so over the ensuing years, I worked for a whole host of different types of companies and ran different types of companies. And then about 11 and a half years ago, we decided to start CureMetrix. We were seeing some trends in industry. We were seeing that the cost of storage was coming down, the cost of compute was coming down, the speed of compute was going up. And so we'd been working with some data scientists who had some ideas on how to apply this. And so we decided, okay, let's move into healthcare and bring online a company that focuses on doing AI in healthcare. And so that was really the genesis of CureMetrix.
Why healthcare? What was the motivation for that? What was the carrot on that one?
Sometimes the stars just align. So for me
Yeah.
personally, I had worked in a whole host of industries. I had worked in consumer information, real estate, construction project management. I was a C-level exec in a large-scale insurance company.
Oh, wow.
I'd been kind of all over the board.
Yeah.
And I live here in San Diego, and San Diego is one of the biotech capitals of the world. And I just thought to it was interesting. You put things out to the universe sometimes, right? I thought to
Yeah.
myself, okay, I've never done anything in biotech. I think it's time. And literally within about a month, I got a call. This other company I was working with running, we had pitched this group of VCs, and they're like, "No, we're not going to invest in that. It doesn't sound like a good deal for us." They called me up about a month later, and they said, "Okay, we didn't like that other idea, but we like you. We're starting this company in the healthcare space using AI. Would you be interested?" And so it was like, it just came together.
It just pulled you together in that this one common moment. That's pretty interesting.
Sometimes you just got to follow where it leads, right? So,
That's that's exactly it. Just a quick side story, just to relate to that, is that the last year and a half, my wife had an actually serious health issue, and so we were kind of, airdropped out of our life into a completely new life for about 18 months. And I spent a ton of time reading, and I'd never really spent any time in healthcare as a patient or otherwise. And now I was immersed in it. I was basically at the hospital every day, and it kind of intrigued me in healthcare. I got kind of interested, and then we started reading books. I'm like, oh yeah, this is really interesting. There's nothing in this realm that isn't interesting. And the next thing you know, I got asked to be a host for a healthcare podcast. So you're right. You never know what's going to happen. If you got to be careful what you ask for, I guess.
that's right. So I've been thinking a lot aloud about winning the lottery, and
Yeah, me too. Yeah, that's great. So let's go. Listeners are probably going, okay, what's CureMetrix? Tell us more about that. What is this? And so they're the one, they came to you and said, this is what we got. And how can you help us?
Yeah, so there were a couple of data scientists that had doing work for NASA in space weather prediction. And
Oh,
so they had some interesting algorithms. They were really brilliant data scientists, but nobody was really clear how to take what they were doing and apply it into healthcare. So
right.
part of the first Genesis, the first couple of rounds, first couple of months with the company was actually, looking at what these data scientists had from a tech perspective and looking at healthcare and seeing where the alignment lay.
Yeah.
And we did a lot of stuff looking at predictive modeling. Could we predict patient outcomes? Could we predict sepsis? Could we predict which patients who enter an emergency department will end up needing a bed? So
Right.
we can help hospitals with operations management. We were looking at a lot of those things, but nothing was really sticking. And so I went back and really sat down with the data scientists, really tried to absorb what they were doing. And the work that they had been doing was not just an algorithm, right? It was computer vision, image analysis, predictive modeling. And so when I started to look all that, I was like, okay, what if we could take this and apply it to radiology, right? I mean, there's uh, countless radiological images generated every day all around the world.
Hmm.
And for the most part, at least at that time, they're all read by eyeballs.
Yeah.
And so, is there an opportunity to optimize this process, to improve outcomes for patients, to make it easier and better for the doctors, to make it less expensive for the healthcare industry in general? And so that was the first epiphany. But then, okay, now you have all of radiology, right?
Yeah.
So now what do I start looking at? X-rays of ankles or MRIs of brains, or right, where do you go? And so, we started looking around, and interestingly enough, it just some things were happening in my personal life. My wife's mother, my mother-in-law, had breast cancer, so there were some things going on that end. Um, we were looking at some of the variety of images to see where this could apply, and
Hmm.
again, things just started to fall in place that
Hmm.
mammography might be an interesting path to look at. And from a business model, it made sense.
Hmm.
In the United States, there's 40 million mammograms a year that happen year over year over year, right? So there's plenty of volume and repeat volume. Women come in, or they're supposed to come in every year, but women come in over and over and over again. So you have longitudinal data for individual patients, and you have all this data. And then it's not just a US problem, right? So that you have mammograms happen everywhere, all around the world. So that was the first thing. The second thing was we looked at how well is mammography performing today. We looked at true positive rates, false negative rates, and what we found was that there were a lot of challenges with mammography. If I break down some of the numbers for you, and I realize your listeners aren't taking out an Excel spreadsheet, but um,
Well, some might be.
if you start with 1,000 mammograms, in the current practice today, radiologists will recall about 100 of those patients, meaning they looked at the mammogram and they saw something and they said, you know what, I want you to come back for additional imaging. Of the 100 patients they recall, they might biopsy about 20 of those patients,
Hmm.
right? So that
Hmm.
means 80 of those patients were recalled for imaging but didn't need it because
Didn't need
whatever
it.
they found didn't require biopsy.
Right.
And of those 20 biopsies, they're going to find about 5 cancers. So,
Hmm.
when you look at that cancer detection rate of 5, 6 per thousand, it's a pretty low
Pretty
detection rate.
low. Yeah.
But when
Yeah.
you look at the biopsy rate and the recall rate, it's pretty high.
Right.
And so we thought, okay, maybe we can help here. Maybe we can do something better. And that was really how we got launched into this whole effort.
Very interesting. So that's taken you to this up today, and so where's CureMetrix at now? What
Right.
stage
So,
of development?
we spent a bunch of years building out this AI for breast cancer detection. We had a
Right.
whole suite of products around that. And one of the things that we found that was super interesting is when you're training an AI algorithm to find breast cancer, you have to train it to find everything that isn't breast cancer and throw that
Oh.
stuff away to reduce your
Oh.
false positive rate.
Oh. Okay. Interesting.
One of the things that we were finding, scoring, and throwing away are something called breast arterial calcifications. It's basically a stiffening or hardening of the arteries of the breast. They're not breast cancer. They're not tied to
Right.
breast cancers, but they throw a bunch of false positives. So
Okay.
we were
Right.
finding these things, scoring them, and throwing them away. And at the time I was doing that, as a company, we were doing that. I'm always reading medical journals and papers and seeing what's going on. There started to be more and more chatter around that these breast arterial calcifications may be linked to downstream adverse outcomes in patients.
Oh, really?
So we started doing a bunch of research. We started collecting more and more data from our hospitals and our partners to say, okay, let's look at these breast arterial calcifications and see, are they indeed tied to these adverse outcomes? And in fact, we put out a paper with UC San Diego in JACC Advances, which is a journal. And we looked at um, 18,000 women about over an 11-year period of time. So a lot of women, long
Mm-hmm.
period. And we said, okay, what happens when women have these breast arterial calcifications? What are their outcomes? And in that paper, we talked about finding almost a 3 times higher odds if you have breast arterial calcifications for coming out with MI, myocardial infarction, MI, heart failure, stroke, or some mortality or some composite of those, right?
Really
So just the presence was increasing the outcomes for these patients.
was an identifier. Wow.
Yeah, and then we looked at younger women too in that study, right? Because you got 18,000 women, and what we found was when you looked at the 10-year survivability of patients, and there's these things called Kaplan-Meier curves, but when you look at these two curves, in younger women, the women who survive versus who don't, the curves separate for those who have breast arterial calcifications. So survivability goes down um,
Really.
just for the
Wow.
presence of having these things. Yeah, so it's been a really powerful learning journey um, on this indication in the human body.
Interesting that you have this throwaway data that you think is
Right.
really streamlining your focus so you can actually pinpoint what you're looking for, and you find actually there's a connection from that to a completely different health issue.
Yeah. Exactly. So yeah. So then we
Wow,
started thinking,
incredible.
okay, with this understanding, and by the way, it wasn't just us, right? I mean,
Right.
if you look at the body of research, there's hundreds of papers published all over the world, and more coming online every day. We're publishing some, but we have partners as well, and that talk about this. And there's ties between breast arterial calcifications and chronic kidney disease, or cerebral vascular disease, or diabetes, and if you think about it, the stiffening of the arteries is a vascular condition. And so
Mm-hmm.
it's not surprising. We may be seeing it in the breast, but it's an indication that there may be something going on systemically in the human body, and we're just seeing a certain manifestation of it.
Right. And this exam is something that happens for women ideally every year they get this done. So this is as you go you're collecting ongoing data, and that's the interesting thing about AI and the data processing stuff is that the more data you get, the more information and the wider the reach of that information too, right?
That's right. Yeah. So it's been a fascinating journey, right? These respiratory calcifications are something called an incidental finding.
Hmm.
But if our thought process was if we can take these 40 million mammograms a year and give women more information that's more important for their health, that's powerful. 5 times more women die from heart disease than breast cancer.
Is that right?
Right. I mean, everybody's incredibly scared of breast cancer, as you should
Yeah.
be, and it's something that's to
Yeah.
be managed and treated and dealt with. But heart disease is kind of a silent thing in women's health. And I mean, I know from my own experience with my wife and her doctor, I mean, doctors don't always react the same to women as they do to men when they come in with different complaints. So we saw this really as a huge opportunity to have an impact, again, for the patient, for the provider, for the healthcare system. If we could help get in front of what was impacting these patients, we may be able to change lives. And that's really the mission that we've been on for a long time.
And so when this information comes back. So who actually receives the information back? Is it the primary care doctor or the primary care who ordered the mammogram?
Yeah, I mean, so it all starts and ends initially in the radiologist's office, right? They
Right,
conduct the mammogram and they do the first read of the mammogram. So any
right,
information that's coming out of the mammogram is provided to a radiologist.
right.
They make the determination based on what they see and what's in the patient's chart, et cetera, about what's to do next. But most typically, they refer back to what's called the referring physician, which could be the
Mm,
primary care, the
right.
OBGYN, who then takes in that patient and says, okay, I see something going on here. Let's run some additional tests. Let's do some additional evaluation and figure out, do you need diet and exercise? Do you need statin? Do you need, where do you fall on that spectrum of care for what's going on in your body?
So where do you insert CureMetrix in that trajectory, and who does that?
Right. So what we did is this is going back a couple of years when we figured out after all this research that breast arterial calcifications had these impact. We then, I mean, I don't want to say that's the easy part, but that's only step one in the journey,
Right.
right? Step two in the journey now, and definitely a hard part, is taking these concepts and ideas and making them into a product. There's a very big difference between a project and a product, and even a
Yeah.
product and a business,
Right.
right? So, productizing something like this requires going through the FDA because this is what's called software as a medical device. So, we had to collect more data, we had to rigorously test and evaluate the data, and then build a product with appropriate labeling that tells the radiologist how it works and what it does do, what it doesn't do. So now we have this product called CMangio. And CMangio lives in the radiologist's office. Actually, let me say it lives in the cloud, but the
Right.
process lives in the radiologist's office. So a woman comes in, she has her mammogram just as she would today. Nothing is different. There's no new radiation for the patient, no different effort at all for the patient. It's totally
Same procedure.
transparent,
Yeah. Yeah.
completely transparent to the patient. And when the mammogram is captured, a copy of the mammogram is automatically de-identified and encrypted and sent to us. We process it and we return results to the radiologist, who then, when they're evaluating the mammogram for breast cancer,
Mm.
has a scorecard now where they
Hmm.
can evaluate this patient for the presence of these breast arterial calcifications. So our scorecard not only indicates whether or not it's absent or present bilateral,
Right.
but the CureMetrix CMangio scorecard also localizes those arterial calcifications and shows on thumbnails on the scorecard where they are and what they look like.
And the radiologist is the one that's evaluating and reevaluating or assessing and checking the scans and doing their job that they're supposed to do. This doesn't eliminate that person or that step of the procedure
Doesn't eliminate them at all. In fact, this is intended to be used by a
by them.
radiologist,
Yeah.
right? So, as I said earlier, this is actually an incidental finding today. So,
Hmm.
even without our software, radiologists, as they read the mammogram, they can see these arterial calcifications and they're supposed to see them, evaluate them, and make a determination on what to do next. So what our software does is it helps objectify and standardize that process. The
Right.
AI sees all mammograms equally, so to speak, right?
Yep. Yep.
It doesn't get tired. It looks at what's going on and it does this detection process and then presents this scorecard to the radiologist. It's then their job to go, okay, here's what the AI saw. Do I see the same thing? Yes,
Right.
confirmed. Now, what do I
Compare
want
and
to do with
evaluate.
my
Right.
patient? Right. And so then they make the
Right.
determination and they manage their patient.
It just gives them that extra layer, that extra level of information and about
Absolutely.
and validation, I guess, right? That
Yeah.
what they're seeing is accurate, and that yeah.
And what we find actually, it's interesting. I mean, I don't know how we would do this on the podcast, and since it's an audio, it probably wouldn't work. But if I showed you pictures of what a breast arterial calcification look like, imagine like these white earthworms on an X-ray, right? You have
Okay.
an artery that traces through an image, and it's calcifications like white spots within the artery.
Mm-hmm.
It looks like an
Right.
earthworm. The bright, long, egregious ones, doctors can see today.
Right.
And they've been able to see with or without our software. One of the benefits that the software brings is it can find the faint ones that they may either be overlooking or missing.
Mm.
Again, the
Mm-hmm.
number one primary purpose of a mammogram is screening for breast cancer. And the doctors work really hard, and they've been trained to scour that mammogram for breast cancer
Mm-hmm.
and disregard everything else,
Right. Of
just
course.
like our
That's their
software
focus.
was,
Right. Yeah.
right?
Right. Right.
So now, as an incidental finding, they can still do that, and then we can bring after the fact this scorecard that helps them assess.
Yeah.
Oh, okay, CureMetrix found this; it's faint. They can then go back and look. Oh, yeah, there it is. That's right. Okay, now I know what I want to do with this patient.
Interesting. So they're using this process of elimination, just like your algorithm was, but now you're bringing that back and saying, oh, by the way, yeah, we've eliminated all that, and you can now see exactly what we're reaffirming that. But here is another layer. There's something else to bring to your attention, so they can still focus on what they've been trained to do, but this gives them a little extra benefit of some,
Absolutely,
because they can only go on the information that they have, and that just gives them more information to work with.
that's right.
Wow. Cool. Wow, that's really cool. And so this is so let's go back to, so you started working, what was your first role with CureMetrix when you came on board? What were
I was
you
the CEO. I was hired on
you
as
are
the
right
first.
on the
Yeah.
gap. Okay. And so tell me about your experience moving, transitioning from where you were into this. And what did you kind of tap into? Like, did you had to take on you had to learn a lot, obviously, but for yourself and becoming a leader of this organization, what did you tap into for fulfilling that role?
Yeah, it's a good question. I had to break this down into a couple of different categories. Anytime you
Okay.
jump into a new, I'd run other companies before, right? So,
Right. It wasn't your first new rodeo. Yeah.
right. So, I mean, there's a variety of things that have to happen. One, I had these data scientists, right? They came with the package.
Right.
So I had to learn who they were, what their technology did, what it didn't do, and so I had to spend a lot of time with them, really getting deep. And I mean, I'm technical to a certain extent,
Right.
but
Not as
as they
technical as
say,
them, but
not no. I mean, these people were like genius level. In fact, one of them still works in the company every day. Love him to death, and he is amazing. And I will often say, to this day, he is always the smartest person in the room. I mean, just he's just an amazing man, and just knows so much and sees
wow.
things through a lens that nobody else can see things. So I had to start by trying to see things through his lens and trying to
Mm-hmm.
understand the technology that he built. So
Mm-hmm.
that was one thing to do, because again, project, product, business. We had a technology, but we had a solution, but we didn't have a problem. We didn't know what we were going to
Right.
solve with it yet. So that was
Yeah.
my job, is to figure out what product
That's
we're going
right.
to develop.
You hadn't discovered that the area of focus yet. Right.
Right. The next thing I had to figure out was, okay, healthcare and radiology. I'm not a doctor. I've had X-rays. I've been to a doctor, but I don't have a career in healthcare, so I had to figure out how to learn. So I went in a couple of directions. Here in San Diego, I went to the chair of radiology at UCSD and talked to him and asked him to be a mentor and a guide to me.
Oh
And
wow.
he ended up actually becoming our first chief medical officer.
No kidding.
He liked what we were doing so much that as he was retiring from UCSD, he came on board to be our first CMO.
No
Um,
kidding. Wow, what a find.
yeah, so I went and got a lot of clinical knowledge from him, and he just dumped a brain full on me.
Yeah.
I also went on the healthcare executive side. So I talked to a bunch of VCs who eventually I would want to have fund us. And I said, who do you know? Who's done this before? Who can you recommend? And they had connected me with a gentleman who had actually taken one of our competitor companies and sold it to another company, and had been a kind of a known quantity in the business, but at the time was retired.
Right.
And so I pulled him in, and he became like a professional mentor on the med tech side and on this niche part of the industry. So
Mm-hmm.
I pulled in a lot of advisors and mentors to really help me ramp up as quickly as possible.
Is that something you did in the past? Is create this circle of knowledge around you to help support you?
It is. I mean, that's just how I operate.
Yeah.
Some people will just go to the library, go online, and order 100 books and read them all.
Yeah.
Um, I like to riff with people. I learn by
Hmm.
listening. I learn by asking, um,
Engaging. Yeah.
engaging. So I wanted to have people that I could rapidly come up to speed
Hmm.
on. And I wanted introductions, right? So there's a couple of really marquee industry conferences every year. I needed somebody who would take me around, introduce me, tell me who all the players are, et cetera. So
Right.
I had these guys, kind of being my tour guide through the industry at these
Yeah,
conferences and
right.
trade
That was
shows.
smart. Yeah, great. Great way to do that. Because they would have been, having had such long careers in the industry, they would have had many connections.
Yeah, they knew everybody, and everybody knew
Yeah,
them, which built some
right.
credibility for me, which I had none,
Yeah,
right? So
yeah,
I had
yeah,
to,
exactly.
I had to build some.
And then, what do you infuse into your team now? What kind of leadership skills do you lean on now? Is it? I mean, it sounds like you base a lot of your decision making on trust, because you sound like you trust your people that you work with. But what other kind of values do you kind of build into your leadership?
It's interesting you ask. We're actually hiring a couple people right now, and I often get asked, what's the culture of the company?
Yeah.
Um, I've really focused hard on building a company made up of adults and professionals.
Mm-hmm.
We don't have a lot of drama. When I hire somebody to do a job, I want them to be the best at that job. I don't want to micromanage them. If I have to hire somebody to do a job and I have to tell them what to do or tell them how to do their job,
Mm-hmm.
then I hired the wrong person, right?
Right.
I have my job. It keeps me very busy.
Yeah.
So I
I
I
need to do
want to have
your job too.
I need to count on you to do your job the same way that you count on me to do my job.
Yeah,
And I
exactly.
don't like to be micromanaged. I don't work well for others. So I try not to micromanage others either, right?
Right.
Every now and again, I have to play the role of making the decision because somebody has to arbitrate when there's a lot going on. But I want adults and professionals, no drama, know your job, do it well. If we're doing something wrong, fix it. If you need help, ask for it. Like I like to think it's a good culture. Sometime have my team on and you can ask them.
Last Brock.
Sure, you could ask Brock.
Actually, you talked about problems or challenges. So, what kind of challenges have you actually met with CureMetrix at this point? Is particularly with the advancing AI.
Yes, I mean that's an interesting thing.
Mm-hmm.
There's been what I'll call an arc of problems. So initially, if you go back, I don't know, 6, 7, 8, I guess 8, 9 years ago, even though we saw that AI was going to be exploding,
Yeah.
doctors didn't, right?
No.
In fact, initially they saw this as a giant threat. Wait a minute, I read mammograms all day. If you're building software, is it going to replace me? Am I out of a job? There was a lot of pushback and fear from the doctors, and not just with my product. There were lots of other
Mm-hmm.
AI products that came along, and a lot of people had that same concern. But we got past that because I think eventually the doctors began to realize, wait a minute, this isn't, first of all, the FDA doesn't clear it to replace a doctor. That's the first thing. It's
Right.
cleared to work with a doctor, right? So
Right.
now, okay, this is a tool for me to use. Okay, great. It's a tool. Now, how do you use it, right? So this was an ongoing conversation in education, but that was kind of the first thing to get people over.
That's the
Um,
mindset across the board. It doesn't matter what industry you're in or what job you're in. It's like that mindset of switching it from being replaced to being actually just a tool to make your job easier or better or faster. Or that's it's very common.
the second one, I think, is this perception that AI has to be perfect, right? We
Yeah.
see this in the self-driving car world. One Tesla has one crash, and it's on the nightly news, right? Meanwhile, if you look at like the per mile auto crash rates of us as drivers
Humans make
versus
way more mistakes.
way more mistakes. Um, the same thing applies here, right? If
Yeah.
if the AI can run at 2 in the morning or 2 in the afternoon, it can run on a 6 foot tall patient or a 5 foot tall patient. The AI is It doesn't care about any of that, right?
It
Doesn't get
doesn't need
tired, doesn't
caffeine. It doesn't use melatonin or
it
serotonin.
doesn't
Like
have good days or bad days. I mean,
migraines. Yeah,
it
like
doesn't
none of
have
that
any of
stuff.
that,
No.
right? So the AI acts in a very consistent manner. That
Yeah.
said, it's never perfect, right? It will make mistakes. There will be false positives. There will be false negatives because the AI, one, it's only as good as the training data you put into it. And two,
Mm-hmm.
even if you had the vastest amount of perfected training data, it's still going to make mistakes. And
Mm-hmm.
so getting people over the hump of accepting that
Mm-hmm.
was the next challenge. So
And
now
you
we've
still
got them
need people, you still need drivers, operators of AI that can
right,
catch those mistakes.
right.
That's the key, right?
Right. So then, to get over that, we talked about one of the things we do is if you look across radiologists, there are some fellowship trained breast imagers who do nothing but read mammograms all day. But
Mm-hmm.
there are some general radiologists who read a couple of mammograms a week. So if we can help bring the general radiologist up to a level of, a more seasoned senior
Mm-hmm.
mammographer by giving them more information, more tools, that's part of the benefit that an AI like this actually provides.
Right. Right. Yeah, that makes sense.
And I think beyond just those kind of challenges, I think the last big one, I can go on because our life is filled with challenges, but
Yes.
the
Yeah, like
last big
how
one.
much time do we got?
Exactly. Our last big one, I think, would probably be regulatory,
Oh yeah.
because
Yeah.
clearing a product like this is not just about saying, yep, it works, let's go to market. The FDA has very crisp regulations on what you can say, what you can't say, how you have to test the product, how you have to validate the product, the um, biostatistical metrics you have to use to ensure its performance. I mean, so the good news is, right, I feel very secure when I use a product or a drug or something that has gone through this massive amount of under a microscope testing and rigor to come to market, because I've gone through it and it's not trivial. The bad news is it's not trivial. It's, a huge amount of lift, and AI, as it has become more ubiquitous and more products, the FDA has gotten more wise and more
Mm-hmm.
stringent
Mm-hmm.
on what they ask for, what they seek, how they compare it to other products and predicates and current standard of care. So it's a lift. It's a
Yeah.
very big lift.
Perhaps the FDA needs to adopt some AI.
It wouldn't surprise me if they already have and just haven't told us, but
They haven't told anybody, or they're not using it to speed it up at all.
hey, chat, is this a valid submission or not? Right?
Should we approve this or not?
Exactly.
That's funny. Yeah, I've heard that before. It is not a process for the faint of heart. You go into that, and in some cases that's what prevents people from moving forward, because it was a big step.
Yeah, it is definitely a big step. I
And
mean,
so you're
go ahead.
go ahead, sorry.
I'd say if I had to put one more challenge on the plate, so getting acceptance, getting adoption, getting clearance. Now the last part, of course, is getting sales. So
Right.
convincing somebody to actually open up their checkbook or their Venmo or their whatever we have today and pay for this. I say checkbook. I've dated myself, of course,
Yeah,
because
really.
my
Apple
kids have
Pay.
never written a check. But
What's a check, Dad?
exactly,
You only ask for the check at the restaurant.
yeah. So getting the customers to understand the value proposition, the impact to their patients and their bottom lines, so that they will pay for the software. That's the final hurdle.
So that's where you're at now. You've gone to market.
We have gone to market, and fortunately, we have demonstrated value to customers. So
Hmm.
we are making sales, and we've got happy customers and a growing business.
How do you approach that? What's your what's your go-to plan for sales right now?
Well, it's a smallish industry.
Hmm.
Radiology is one sect of healthcare, and mammography is one sect of radiology.
Yeah, it's very niche. Yeah.
It's pretty niche. So it's a combination of outreach at trade shows and conferences, outreach from our business development reps, outreach from channel partners that we have and places who people who we're engaged with and resellers that we're engaged with.
Hmm.
And once you get in front of the right person, because we could talk to a hospital that has 50 radiologists, and if you're talking to radiologist 49, they're deep in the machine. They don't have a whole lot of influence or power, or they're
Right.
not a partner. So you got to work your way up, as with all sales, right? There's the
Yep.
influencer, the decision maker, and the buyer, and you got to figure out who those people are, get to them, have the right message for them. It's definitely a process.
When did you actually go to market? How long has it been?
We got our FDA clearance, our first clearance on this product in October of 2023. And we actually, believe it or not, had our first customer signed in November of 2023. And they were live, at least under a trial agreement, in December of 2023. So it was a pretty quick thing, mostly because I go to conferences and trade shows. We'd been
Right.
on the radar of a couple of these big players for some time. And when they saw that we finally got the clearance, they already knew that there was value for them and their patients. That was a pretty easy lift for us.
Hmm. Hmm.
But you know, every sale is unique and requires a lot of care and feeding.
Do you find that education is probably paramount right now for you? Is helping people understand what this will do or could do for them? Is that is that why the trade shows? Do you guys speak at these functions too?
Yeah, and that's the purpose of all the research papers, the speaking at trade shows, podcasts like this, right? I mean,
Yeah.
sometimes luckily I get on the phone with a doctor who says, I totally get it, I totally understand it, the science is right on, I've been tracking this for a long time. We just have to convince my CFO to do this, right?
Right.
And those are the ones I love because
Right.
the business model's easy. Sometimes I get on with a doctor who says, yeah, I don't know. I see these things. I don't know why I need AI to help me see these things. I don't know how critical they are or how important they are. We're going to hold off for right now. And, my head wants to explode when I'm like,
Yeah.
I know the data. I see what this means for patients and their health. Like, you're killing me. So,
Where you're seeing, because you're seeing the patient's bottom line, they're just seeing the bottom line, right? They're just
no,
looking at
no,
the
no. I
numbers.
don't mean it like that at all. They see more than I do. Doctors
Right.
see the patient's bottom line,
Right.
absolutely. But
No, I meant the
our
CFO.
the CFO, sorry, yeah.
CFO. Yeah.
But in our healthcare system today, I mean, our radiologists are busy. Like, we
Yeah.
had to build this
Yeah.
software with no new clicks and no buttons
Yeah.
and like as little effort for the doctors as we can because they're already
Yeah.
overwhelmed with work. So,
So it's
it's
fairly seamless for them then. They don't really, there's not much extra for them to do. It's just send.
no. The whole process is completely automatic up until the point when the scorecard is presented to them. And then
Interesting.
what they have to do
Wow.
is look at our scorecard and form an opinion based on what they see and based on what they know about the patient. So no clicks, no buttons, no nothing extra for the radiologist.
So cool. No wonder and when they see it, they're just like, yeah, bring it. I want it.
A lot of doctors are, right? We talk to a lot of doctors who are very excited this is finally coming out and finally in the market. They know what this means for their patients, and they see this as a huge opportunity to impact their patients' health.
How do you see AI playing a role in advancing care for women?
I think it's really interesting. AI is a really broad topic these days, right? I
Yeah.
mean, you have everything from
Yeah, it's pretty wide. Yeah.
chat, and we, as you and I were chatting before we went on, like I just spent some time in Japan with my family, and I used chat to help us plan what we were going to do. Like,
Yeah.
hey, I'm in Osaka for the day. This is my family profile. What are 5 things that would be interesting for us to do today? So you can have this interactive exchange
That's
with
cool, eh?
chat.
Yeah.
But you can think about that also in the healthcare context.
Yeah.
And I think that there's the opportunity to say, hey, I've got this patient. These are some of the things I'm seeing. This is the diagnosis that I'm thinking. What might be some other things I should consider? Right. So I think the more information that chat, for example, can digest in that context, the
Mm-hmm.
more opportunity there may be for that type of AI to actually begin to assist patients and doctors in helping to understand what's going on. Will it become a better diagnostician than the doctor themselves? I don't know. But does the AI have access instantaneously to a million papers with
Mm-hmm.
instant
Real in
recall?
real time. Yeah. Yeah.
It's
Certainly it does.
an interesting thing to talk about. So that's one side of AI, and then the other
Mm-hmm.
side is like the place where we live, where when you can take in all of these data points from a patient, we're the image side. But associated with images, there's other patient data. What's your blood pressure, your heart rate? Are you pregnant? How old are you? Your veteran status, your marital status. Like, there's a whole array of information that we as patients have in orbit around us.
Mm-hmm.
That again, if the AI can see patterns in that maybe the human can't, there's some interesting opportunities there.
Yeah, I think so. Well, I think you just well, you identified one earlier by saying that what you eliminated was something that was became useful and that was able to actually be benefit from, and the AI found that, which is really interesting. So when we're talking, if we're thinking about whether we got some people listening who are maybe nearing the end of their education or newly out of graduating and are in the healthcare industry, are there gaps in women's healthcare that you see, or maybe some of the biggest opportunities for people as they're sort of navigating the AI and how that's impacting jobs and careers right now? What are some of those opportunities for people out there who are moving into healthcare?
Yeah, I mean, I definitely think if you look at the confluence of AI and healthcare, this is going to be something that's going to be powerful and impactful moving forward.
Mm-hmm.
The healthcare system in America is amazing, but it's also very challenged.
Mm-hmm.
It's expensive. Oftentimes, there's long waits. I think that there is a huge opportunity to stratify the work of healthcare and begin to identify which pieces could actually be safely automated. Um, and I think that that's a place where people can start looking. That doesn't mean we're eliminating doctors. It doesn't mean we're
Right.
eliminating nurses. But I do think it means that we should look for opportunities to put these folks into their highest and best use and at the
Mm-hmm.
top of their license. Basically, doctors should be operating at the top of their license at all times, and anything we can do that is not in that realm, that AI can be used to better filter patients as they're coming in, to better treat patients from home, to all these types of tools so that doctors can operate at the top of the license. I think that is a big opportunity, and I think that will improve care for everybody.
Yeah. Yeah, because some of those areas that you mentioned are very top heavy, and that's what kind of bulks things up, slows processes down, and makes things more expensive, right?
Yeah. I also
Interesting.
think, for example, if you look at screening, like in radiology and images, for example,
Mm-hmm.
it would be my hope that at some point in the not too distant future, softwares like ours could be used as almost a pre-read for the doctors.
Mm.
If the doctor's
Yeah.
going to read 1,000 mammograms, and as I said, let's say there's 5 cancers or 6 cancers out of that 1,000, today the doctor's got to read all 1,000.
All of them. Wow.
What if there was a better way where doctors only had to read 900?
Yeah.
Let's say you only trusted AI 10% of the time.
You
Let's say,
eliminated 100 scans. Yeah, no
right?
kidding.
But I mean,
Yeah.
I honestly believe you could probably eliminate 400 or 500 of those scans with the right AI in the right place, tested in the right way.
Mm-hmm.
Nobody trusts it yet to do that, right? The patients I don't think trust it. The doctors I don't think trust it. I don't think the FDA trusts it.
No.
But I think that there is that opportunity. If you thought about, well, if doctors had to read 30% less scans, let's just say, because the AI pre-read and with 99% certainty said there's nothing here in these 30%, what could doctors do with that 30% of their time? And
Exactly. Yeah.
it's an opportunity. but I don't know that we're there yet.
Yeah. But that's the future.
That's the future.
Awesome. If people want to learn more, where should they go if they want to learn more about CureMetrix, Kevin?
Yeah, so I mean, obviously we've got a website,
Yeah.
curemetrix.com, and it's with an X on the end, curemetrix.com. And that's probably the best place to go. I mean, obviously there's journals and lots of other things, but if you're interested in any of our papers or research, that's also on our website.
Or becoming a customer.
Or becoming a customer, absolutely.
Absolutely. Right.
I would love to talk to you.
Okay. And you're also on LinkedIn if people want to track you down there as well.
Yep.
But any other last points and things you want to mention before we sign off, or maybe even some resources that people could tap into if they're looking for that?
Yes, I mean, I guess what I would just say is I'm super excited to be on, right? And to be speaking to your audience. This is, as I think you pointed out earlier, it's a journey of learning and a journey of education. So
Mm-hmm.
every opportunity that we get to be out there and making people aware of this, you'd be surprised how many women I talk to don't even realize that breast arterial calcifications are a health issue that they should be paying
Mm-hmm.
attention to, they should be asking the radiologists about.
Yeah.
And then when we get into the radiology sector, most radiologists are aware of it, but even there, some docs are, this is somewhat new to them. And so, yeah, I definitely think that we need to do a better job of educating the public. And I mean, if only I had a celebrity spokesperson in the middle of the Super Bowl who could, you know, tout this. But first, I've got to find a $10 million check to write them. So I'm
Or
working on it.
maybe they're listening right now. You never know,
Maybe
right?
they're listening
You
right
never
now,
know.
and they want to come and help us out.
Well, awesome. I really appreciate your time today, Kevin, and I've enjoyed talking with you and learning about you, CureMetrix, and CM Angio. It's been a pleasure to hear your stories, and yeah, I want to hear more another time and catch up, and we'll do this again.
Thanks, Heath. I really appreciate it.
Here we are again talking about AI in healthcare and how CureMetrix was founded to leverage AI in healthcare. And so cool that they were actually using that technology to identify cancer, breast cancer in women's mammograms. But through that process of elimination, of pulling away the information that they knew wasn't what they were looking for, they determined that they actually found other indicators of health risks with the CM angio, breast arterial calcification. So that's really cool that they were able to sort of discover that they had another stream of information that was going to be valid to radiologists and doctors in that patient care process. So very cool. So that's where future opportunities exist in automating healthcare processes based on Kevin's experience. So if you're coming out of school looking for a place to focus, that would be a good place to go. So be sure to visit their website, learn more about CureMetrix. And I want to thank you for listening to this episode. Please stay healthy, and we'll see you again soon.